Our next project, the connections between homelessness and health, which addresses goal number 1.
Hello, thank you all for being here. I'm Natasha Advanti, thank you, and this is my project aligning with the UN Sustainable Development Goals. My focus is on the homelessness crisis in Toronto, where over 18,000 people experienced homelessness in 2021. Access to adequate housing is a necessity, yet many shelters have multiple issues that make them less functionable and desirable for those in need. This project is directly connected to the Sustainable Development Goal of no poverty, as homelessness is both the result of poverty and a perpetuator of the poverty cycle. Through this project, I will establish and explain the intricate and nuanced relationship between housing and health, mental, physical, and social health, the findings of my research through surveys and interviews, scientific journals, government and non governmental organization reports, as well as news articles from local outlets, will help me identify several factors that discourage people experiencing homelessness from seeking or remaining in shelters. And I will suggest ways to improve these factors along with the limitations of their implementation. Homelessness has a profound impact on mental, physical, and social health. Homelessness can cause or exacerbate mental health problems. The experience of homelessness can be accompanied by feelings of shame, isolation, and hopelessness, further worsening mental health struggles. Unhoused individuals are at a higher risk of physical health problems, not limited to infectious diseases, chronic health conditions, and injuries. The lack of access to basic necessities can lead to various diseases. And since they don't have shelter in a climate such as Toronto, where the weather can get very severe, people are at higher risk of weather related diseases. People experiencing homelessness face discrimination and stigma, leading to social isolation, exclusion, as well as a higher risk of violence. The loss of stable income and a stable home may result in loss of social support networks, exacerbating mental health problems, as well as making people feel as if they don't have anyone to reach out to for help. Here are a few factors that discourage people from seeking or remaining in shelters. Overcrowded conditions can make people feel uncomfortable due to the lack of privacy and personal space. Furthermore, many shelters may not have access to adequate facilities and services, making people reluctant to stay there. There can be many safety concerns in shelters due to higher risk of theft, violence, or abuse, specifically for vulnerable groups such as religious minorities, LGBTQIA, and differently abled people. There are a lot of shelters that are also not accessible, making it very difficult for differently abled people to move around in the space. Some individuals may be reluctant to use shelters because of the stigma associated with homelessness, leading people to feel extremely ashamed and discouraged from seeking help. Furthermore, there are people who want to seek help, but there may not be sufficient resources in terms of support services to help them improve their situation. Many shelters require people to leave during the day so they can't store their belongings and go to work. Furthermore, the intake and the leaving time may not be compatible with their work hours, forcing them to remain unhoused. So, there are ways in which the system can be improved. For example, designating accessible female only LGBTQIA plus only shelters with employees from the same community to create safer spaces. However, there's a risk that these shelters may not be located near the designated population. We can allow people in the shelters to support and contribute in its maintenance and cleaning in the case of employee shortage or exchange and perhaps exchange wages, providing them with jobs as well, which can also cultivate a sense of community and respect for the space. The system can be adapted to make it more work friendly. This could mean allowing employed people to enter and exit according to their work hours. The most important um, solution, in my opinion, would be to combat the stigma about people experiencing homelessness by raising awareness and also engaging in community engagement activities to cultivate a sense of empathy. A huge reason why these shelters have factors that discourage people from remaining in them is because of lack of adequate funding, and public support is extremely essential to reallocate government resources to improve the homelessness crisis in Toronto. Thank you so much, and I hope you all have a wonderful day.